Hello and welcome. Today we're diving into blastomycosis, a fungal infection that primarily affects the lungs, but can spread to other parts of the body. We'll explore its causes, how it develops, who it affects, and what we can do about it. Blastomycosis is caused by a fungus called Blastomyces dermatitis. This fungus thrives in moist soil and decaying organic matter, like leaves and wood. Infection occurs when you inhale microscopic fungal spores from the air. Construction, landscaping, and recreational activities near wooded areas or waterways are common ways people are exposed. Once inhaled, the blastomyces spores travel to the lungs, where they transform into yeast. These yeast cells then multiply and cause inflammation, leading to the formation of granulomas, small collections of immune cells trying to wall off the infection. The infection can remain localized in the lungs, or it can disseminate, meaning it spreads through the bloodstream to other organs, such as the skin, bones, and central nervous system. Blastomycosis is not contagious. It doesn't spread from person to person or from animals to people. It's primarily found in North America, particularly in the Mississippi and Ohio River valleys, the Great Lakes region, and parts of southeastern Canada. People who live, work, or recreate in these areas are at higher risk, especially those with weakened immune systems. The symptoms of blastomycosis can vary widely, depending on the location and severity of the infection. Lung symptoms may include cough, fever, chest pain, shortness of breath, and fatigue. If the infection spreads to the skin, you might see raised, wart-like lesions or ulcers. Bone involvement can cause bone pain, and if the central nervous system is affected, it can lead to headaches, confusion, and seizures. Some people with blastomycosis may experience no symptoms at all. Diagnosing blastomycosis typically involves a combination of methods. Chest X-rays or CT scans can help visualize lung anomalies. A sample of sputum, skin lesion, or other affected tissue can be examined under a microscope to identify the blastomyces yeast cells. A fungal culture, where the sample is grown in a lab, can confirm the diagnosis. Blood or urine tests can also detect blastomyces antigens, substances that trigger an immune response. Blastomycosis can present in different forms, primarily pulmonaries affecting the lungs, cutaneous affecting the skin, and disseminated spread throughout the body. Pulmonary blastomycosis can range from mild, asymptomatic infection to severe pneumonia. Cutaneous blastomycosis typically presents with skin lesions, while disseminated blastomycosis indicates involvement of multiple organs and tissues. The manifestation often depends on the immune status of the host. The primary treatment for blastomycosis is antifungal medication. The most commonly used drugs are etraconazole and amphotericin B. Etraconazole is usually administered orally for several months. Amphotericin B is given intravenously and is typically reserved for severe infections or when itraconazole isn't effective or tolerated. The duration of treatment depends on the severity and location of the infection, and regular monitoring by a healthcare professional is crucial. Because blastomycosis is acquired from the environment, prevention is difficult. Avoiding activities that disrupt the soil in endemic areas, such as construction or landscaping, may reduce the risk of exposure. Wearing masks during such activities could also be considered. Although their effectiveness is not definitively proven, there are currently no vaccines available to prevent blastomycosis. With appropriate antifungal treatment, the prognosis for blastomycosis is generally good. Most people recover fully, especially if the infection is diagnosed early and treated promptly. However, severe disseminated infections, particularly in individuals with weakened immune systems, can be life-threatening. Recent research is focusing on developing more effective and less toxic antifungal drugs, as well as exploring the host immune response to blastomyces to improve treatment strategies.